Hi, my name is Tara. I'm going to do my skill validation for oral medications. My patient's name is Luke Skywalker. He's been admitted for a duodenal ulcer, H. pylori. He has a history of depression, high cholesterol, and high triglycerides. I am assigned to give medications for 5 o'clock to this patient. First, I'm going to do my first check, my 5 rights. I'm going to check the Cardex with the MAR and also with the physician's orders. The one thing that I first noticed, well, first for my checks, I'm going to check if I have the right patient, the right drugs, the right time, the right route, and the right dose. I noticed that on the physician's orders, Lipitor was ordered, it's 20 milligrams daily. I'm going to first check to make sure that was done during the day or in the morning for my patient, because they do have a history of high triglycerides and high cholesterol. If that's not done, I'm going to make sure that I can get that administered to my patient at this time, because that is on the physician's order, so that does need to be done. Next, I want to check to see their PRN medications. They are on a Maalox 30 milliliters every 1 to 2 hours. I'm going to see when the last time that was given. If it hasn't been given for the last 1 to 2 hours and they are experiencing any dyspepsia, I will make sure I administer that too prior to administering the medications that I need to administer for 5 o'clock. The 2 medications that I am assigned to administer will be Prilosec 20 milligrams, also amoxicillin 250 milligrams. Amoxicillin would be used to treat the H. pylori. Prilosec is used to treat acid reflux, GERD. So I'm going to take all my information and I'm going to go over to the medicine cart to grab my medications. And make sure I perform hand hygiene before I grab all my supplies. So I need to grab 1 capsule of the amoxicillin 250 milligrams, and same thing goes with Prilosec 20 milligrams. I will grab my medicine cup as well. And all these would still be in their packaging. I would not take them out until I go into the room. I'm going to do my second check here. So I'm going to check if I have the right patient. I'm going to check the right drug. I'm going to check the right route, which would be orally. Both of these can be given orally. I'm going to check to make sure I have the right dose. And I'm going to check to make sure I have the right time as when I'm supposed to give these 2 medications to my patient. I'm going to go next over to the patient's room. And like I said before, the medications would still be in their packaging, so I would not put them in the cup yet together. I'm going to knock on my patient's door. I'm going to come in, wash my hands, and say, "Hi, Mr. Skywalker. My name is Tara. I'm your nurse today. I'm going to go ahead and administer your 5 o'clock medications for you. I'm going to do my 3rd check right here. I'm going to check my patient's name band. If they also can tell me their name, date of birth as well. My patient's a 45-year-old male. Next, I'm going to check to see if they have any allergies. So I'm going to check the other wrists for an allergy band. I'll also check too with the MAR, the Cardex, and the physician's, actually just the MAR and the Cardex, to make sure that there are no allergies to these medications I'm about to administer. Also, there is a hematocrit and a hemoglobin test that was done, ordered at the lab, and so I'm going to make sure if the results are back from that, from the previous medication time he was given, the Prilosec and the amoxicillin, to make sure that those levels, there's nothing that's affecting those to where we'd possibly have to contact the physician before I administer the next dose of medications. So I'm going to let him know that I'm going to administer the amoxicillin for his H. pylori. I'm going to also let him know I'm going to administer his Prilosec. That will help with the acid reflux and the GERD. I am going to take my capsules and put them into the medicine cup. I'm going to make sure I raise him in a Fowler's position. I'm going to also give him a sip of water just in case his mouth is dry. That'll kind of make the capsules go down a lot smoother. And then I'm going to go ahead and have him, if he wants to take them both at the same time, if he can, that's fine. Otherwise, I'll have him take them individually. Make sure he swallows them. I'll have him take enough water as he needs to get them down and to keep them down. If he does have any difficulties with swallowing medications, I would check to see if it can be administered in a different form or if it can be crushed. The form I would check though with the physician to make sure that is acceptable. And after he swallows the medication, I'm going to do a mouth check just to make sure they were able to get down. I would also check on my patient for a pain level. There was an order for Tylenol, but it wasn't from the physician. So if he does need pain, or need Tylenol for pain, if he's rating his pain on a pain scale 1 to 10, and if it's at a high number, I would definitely check with the physician to make sure I can give that to him and get that order for that. I would raise the arm rail or the bed railing. I would lower the bed, and I would do my 6 right, which would be right documentation, and I'd make sure to perform hand hygiene. I'd see if my patient needs anything after this, and I would also check on them after the medication administration to make sure they're not having any adverse reactions to it. Next, I want to, if my patient was ordered a suspension medication, which he is not, but if there was an order for suspension medication, I'm going to kind of go over the directions as to what to do to administer that. The suspension medication, basically the directions are right on the bottle. If there's an order for 600 milligrams for it, first what you would do with the bottle is, it says right on it to add 90 milliliters of distilled water, so I would do that. You need to shake it vigorously. And then there would be a dosage calculation that would need to be done to administer 600 milligrams. So that would calculate out to actually 7.5 milliliters. Once I administer the medication, I would also I would do a reconstitution on the bottle with a different label. I would put the amount of fluid that I added in, the distilled water. I would put my initials, I would put the time and the date. This bottle will only be good for 10 days, so that's why you would have to do a reconstitution on the bottle. Also, one thing I'm going to add, my patient was on a PRN medication as needed for Maalox. That would be 30 milliliters, so I'd also check to see if they were given that previously, and if not, I would have administered it at this time. Thank you.